Hello, my name is Dr. Tateshima, Interventional Neuroradiology. Today, I would like to talk about pulsatile tinnitus. This is a condition that oftentimes misdiagnosed. Patients don't know what to do, how to address this issue. Of course, if you have a tinnitus, you have to go see ENT doctor first. But sometimes ENT doctor cannot fix the problem if it's related to the brain vessels. Then we have to intervene. Here's the summary of pulsatile tinnitus. It is a type of noise that oftentimes patients, they describe rushing sound, almost like a heartbeat right next to the ear. And only 1 to 3% of tinnitus is pulsatile. So again, it's very important that you don't have to come see us first. If you have a tinnitus, you have to go see ENT doctor. And despite that, if you continue to have a tinnitus, particularly pulsatile, heartbeat right next to the ear, then you may want to come see us and get the accurate diagnosis. And pulsatile tinnitus is almost always vascular, which means that it is blood vessel related. The ear is normal. Your ear is normal, but it's just that the blood vessels, abnormal blood vessels or abnormal blood flow running right next to the ear. So your ear hears abnormal noise from the abnormal blood vessels. And one very concerning condition that could cause pulsatile tinnitus is vascular malformation. If it's located right next to the ear, that malformation could give you a stroke, at the same time could give you a pulsatile tinnitus. These are the possible diseases, not just limited to these conditions. There are multiple diseases that could cause the pulsatile tinnitus, but this is the list. So first one, very concerning condition is called dural AV fistula. This is abnormal connection between external carotid artery, that's the artery feeding your scalp, or muscles connected to the brain vessels. There should not be any connections, but sometimes that formation happens, and that's the disease called dural fistula. Some caliber abnormality, like artery losing the caliber because of the atherosclerosis or injury, then artery is kind of pinched, and the disturbance of the blood flow causes the turbulence, and our ear can hear that. And head and neck tumors, or brain tumors, sometimes they contain a lot of abnormal blood vessels, and then we can hear that abnormal blood vessels causing turbulence by our normal ear. High blood pressure actually can cause the tinnitus as well, and it could be bilateral, not just the one side. And this is a little rare disease, but the idiopathic intracranial hypertension. This is a condition that in the brain, the fluid is overproduced, changing the pressure in the brain. We call intracranial pressure. In that condition, sometimes patients hear pulsatile tinnitus. So we have to rule out all these conditions before we address your pulsatile tinnitus and possibly offer treatment. So first thing, we oftentimes get the MRI. This is normal MRI. I can guarantee because this is my brain. Why I had this MRI? Because I have a pulsatile tinnitus myself. That's why I know exactly what you feel. My case, there is no abnormality here and no abnormality here in the brain. But after extensive study, I diagnosed myself. I have cardiac condition. After marathon training, I do marathon twice a year, and my cardiac output increases so high, and then sometimes I hear a pulsatile tinnitus. With that accurate diagnosis, knowing that I don't have any dangerous condition that requires invasive intervention, that gave me the peace of mind, then I'm okay with living with the pulsatile tinnitus. So it is very important to make an accurate diagnosis. That's a very important first step. And this is one of the example. This is a patient with pulsatile tinnitus. You see some abnormal signal here. And this is the MR angiogram called MRA. Further depicts the abnormality here. This is called dural fistula. And as a result of a dural fistula formation, normal large venous sinus, venous structure here, is lost. this patient requires treatment. How urgent? That's the next question. Before we explain the urgency, I would like to explain the type of dural fistulas. There are multiple types, but one thing that we have to pay attention to is this so-called cortical venous reflux. So in a dural fistula, this is abnormal connection from the scalp artery to the large brain veins, disturbing the normal blood flow exiting out from the brain. If this flow is running with the normal flow, the condition is not that dangerous. But if the dural fistula finds the way to the smaller brain veins, we call reflux, then the risk of bleeding in the brain becomes higher. So if this condition exists, we call cortical venous reflux or CVR, then the patient needs to have an intervention urgently, as soon as possible. So the patient like this, there is a cortical venous reflux, unfortunately, in this patient. And because of this condition, unfortunately, the patient developed the large bleeding in the left side of the brain, left temporal lobe, namely. And we got to avoid this condition. And before this happens, this dural fistula needs to be treated. And in order for us to treat dural fistula safely, the first thing is anatomy. We have to know the anatomy. That's why dural fistula needs to be treated by a specialist like us. We do dural fistula treatment quite often. The reason for that is it's not just the blood vessels. Throughout the skull base, there are multiple dural sinuses, blood vessels, and also nerves exiting out of from the brain. So unless you know those anatomy, we cannot offer a safe procedure or safe cure. And this is one of the examples of massive pulsatile tinnitus as a result of a dural fistula, right at so-called hypoglossal canal, where the important nerve controlling our tongue exit out from the skull base. And you can see abnormal blood vessels here, but what's missing here, what we cannot see here in this picture, is these small nerves. And by just seeing those pictures, we have to imagine that where these nerves exist, and we gotta avoid giving injury to those nerves while blocking only abnormal portion of the blood vessels. That requires some skill set and training. And it's not just for the sake of our training, but we are promoting the awareness of importance of knowing anatomy, such as this paper. This is very complex dural fistula, and these detailed microvascular anatomies are not on the textbook. So as we go figure out complex condition and we accumulate the knowledge, then we share that through the publication like this. So this is one of the examples, very complex dural fistula inducing massive pulsatile tinnitus connected from a lot of brain arteries, right side, left side, back side. And in this case, I put the microcatheter around the dural fistula connections, one above this hypoglossal canal, one below the hypoglossal canal, and they injected the medical glue. And after that, the dural fistula is completely gone. Patient no longer has the risk of having a stroke. And also, most importantly, patient doesn't have a pulsatile tinnitus. And this is also another important thing. It's not just a treatment. Because we treat dural fistula or complex brain vascular conditions, sometimes we can identify even subtle findings. I'm not blaming outside hospitals here, but this is a very tough case to make a diagnosis. In this particular patient, the patient was having massive pulsatile tinnitus and had an MRI angiogram, but it was read as normal. But because of ongoing issues, the patient come to see me. And here's the abnormality. You can see that on the left side, there is some abnormal blood vessels, very tiny one here, very tiny one. It is asymmetric, meaning that the right side and left side, they are not the same. Right side of the vessel looks small, and the left side here, slightly larger. And this is abnormal as well. This blood vessel on the left side is large and connected to some abnormal vasculature here. Again, it's very subtle findings, but what bothered me here was the right side and left side. These tiny vessels called ascending pharyngeal artery, to be precise, it's just large. And that was the side of this patient's pulsatile tinnitus. So I decided to do a further little invasive study called the catheter angiogram. And there was indeed a dural fistula. And this was a little dangerous fistula because you can see that there is a cortical venous reflux. And of course, knowing this diagnosis, we treated this condition right away. Tinnitus is gone. And most importantly, the risk of stroke is completely gone. So if you have a tinnitus, pulsatile tinnitus, then you can come to see us. We are more than happy to read normal MR angiogram. It could be very likely normal, but sometimes we find some abnormality that was missed by some doctor. So other conditions, like I briefly mentioned, if there is a narrowing in the carotid arteries near the skull base, we can hear the noise. Oftentimes we see a carotid dissection right around the skull base, then that could cause a noise. This is one of the examples. It's the right side carotid artery, all injured like this. You can see that caliber is very small, and the patient was having a stroke and also the massive noise. And knowing this, we use the ultrasound to find out the true lumen, and we measure the degree of injury to the carotid artery, and we reconstructed the entire carotid artery like this, and here is the end result. Stroke risk is gone, and also the pulsatile tinnitus is completely gone. And other conditions, I briefly mentioned venous tinnitus. It's not just artery, vein can cause turbulence, and our ear can hear that. And you can see that this is the tympanic membrane here. Right next to it, it's the carotid bulb. It's a jugular bulb. It's a vein, and the carotid artery is right next to it. So if you hear abnormal flow from the carotid artery, you can hear also abnormal flow from the vein itself. And this is one of the examples. The patient was having a very disturbing noise, pulsatile tinnitus, particularly during the sleep. And in her case, there are multiple small veins. They are not abnormal. It's just a normal variant. This is so-called emissary vein. This is a posterior condylar vein. She just had multiple veins draining her right side of the brain. And that's the side where she was hearing the pulsatile tinnitus. And we did a little study. I compressed her jugular vein here. You can see that that's missing. Then the noise was gone. And I did a further investigation. By the way, she was awake. And put the so-called microballoon across this emissary vein or posterior condylar vein here and stopped the venous outlet, and the noise disappeared. We made a diagnosis. And of course, we could block this normal vein, but serving normal functions, but it could be blocked. I offered her treatment. We could treat this, we could block this vein normally without inducing any damage or disturbance in the healthy blood flow return from the brain down to the heart. But just making accurate diagnosis was enough for her. She got peace of mind, and she was happy as is. So sometimes we don't have to make the pulsatile tinnitus disappear. Very important thing is make the accurate diagnosis. So if you have any questions, if you have any concern, please have your ENT doctor reach out to us, or you can call us directly. Here is the number. We have an excellent neurointerventionalist in our division. We are more than happy to help you. So please feel free to reach out to us anytime. Thank you for listening, and I see you in the clinic.